A 34 years old woman who has previously undergone a colectomy for familial adenomatous polyposis coli present with firm lesion at the inferior aspect of the rectus abdominis muscle. What type is most likely such tumor? That means what is the name of the tumor? A patient who undergone colectomy for familial adenomatous polyposis coli. That means there is the family history positive and there is a FAP. That means the familial adenomatous polyposis coli. So what may be the cause of a tumor which is present in the lower border of the rectus abdominis muscle, which is a strap muscle, or which is a longitudinal muscle, which is a longitudinal present from the xiphisternum up to the symphysis pubis. So lower border there is a tumor. So what may be the cause? Here the options are myocytes, proliferation of the apocrine gland, chondrocytes, lipoblast and myofibroblast. Here keep in mind that in the rectus abdominis there is no chondrocyte, so there the chondrocyte is not possible. There lipoblast may be present, myofibroblast may be present, but there is the proliferation of the apocrine gland. Actually there is no apocrine gland in any type of the muscle. So there may be myofibroblast, may be lipoblast, and myocytes, actually it may be also the myocyte. So what may be the cause? That means we have to find out the association with the FAP, that means familial adenomatous polyposis coli. For this condition, first of all, we have to see the extracolonic manifestation of the FAP. This is a snapshot which is taken from the Bailey and lab, which is a short practice of the surgery, and this is taken from the chapter number 77, which is the large intestine, and here is the details about the FAP. So you can read the different type of the FAP in here, and also in the FAP there is a smaller area which is discuss about this condition. So you can read out it from the Bailey and lab if you have the enough time, but if you have very short time, usually not to go there. So first of all, here we can see the different type of the extracolonic manifestation of the FAP, the familial adenomatous polyposis coli, which is present usually the colon, and the definitive treatment is the total colectomy. That means the whole of the colon is removed surgically. So here we can see there are different type of the tumor. One of them is from the mesodermal derivatives, and we know the rectus abdominis muscle, it is the mesoderm. So rectus abdominis, it is the mesoderm. So from the mesoderm, here we can see there are different type of the tumors, such as the desmoid tumor. Here you can see this is the desmoid tumor, osteomas and dental problems. So we have to keep in mind in this three structure. One of them is the desmoid tumor, osteoma and dental problems, and other areas such as the ectodermal and endodermal, they are not related with this question, because we know the muscle, it is derived from mesoderm. So we have to keep in mind the desmoid tumor, osteoma and dental problems. First of all, let's see the desmoid tumor. What is desmoid tumor? The desmoid tumor, it is a fibrous neoplasm, and it is arising from the musculoaponeurotic structure. So it is maybe one of the cause of this lesion. So this lesion may be the desmoid tumor. Why? Because it derived from the musculoaponeurotic structure, and actually it is proliferation of the myofibroblast. That means myo means muscle, fibro means fibrous. So muscle and the fascial layer. So muscle and fascial layer, the desmoid tumor, it is derived, and it is usually form overgrowth in the tissue with propensity of the local infiltration. It is very important. That means the desmoid tumor usually not metastasize. That means it is a non-metastasizing tumor. But here keep in mind that it is locally very aggressive. That means it arises in the musculoaponeurotic portion of the rectus abdominis muscle and rapidly grows and invade and infiltrate in surrounding structure. And they accounts for 15% of the familial adenomatous polyposis coli. So this point is very important, that it is associated with FAP, and about 15%, which is a larger amount. That means 15 in 100. It is a larger amount. So the FAP, it is associated with this desmoid tumor, and it is usually biallele APC mutation. So when there is biallele mutation, that means two allele are involved. That means both chromosomes are involved in this condition. There is high risk of development of the desmoid tumor. Here we can see there is a scar mark, and there is developing a tumor and it is the initial stage, so the tumor is not very obvious, and they are commonly in women and also after the childbirth during the in the rectus abdominis muscle. So the women after the childbirth, there is the chance of development of tumor of the rectus abdominis muscle. And what is the treatment? It is, as it is the locally very aggressive and it is a destructive tumor, so go for the radical surgical excision. But here keep in mind that there is very chance of local recurrence. So as we cannot remove the rectus abdominis and the fascial layer of the rectus abdominis, such as the anterior and posterior layer of the rectus abdominis fascia, so in this condition there is a high chance of the local recurrence, and also radiotherapy and chemotherapy also may considered after the surgery. So this is very important, that the desmoid tumor, it is a locally advanced tumor, it is a locally infiltrating tumor, it usually not metastasized, it is derived from the myofibroblast, and this may be recurrent and associated with FAP. So these are the identifying of the point of the desmoid tumor. Here we can see this is the desmoid tumor, and actually these are bowels. So above the bowels there is the parietal peritoneum, also there is the fascia transversalis, and then above them the three important muscle present, which is the rectus abdominis. So here there is the tumor, which is the desmoid tumor. So what is it? As it is the low inferior aspect of the rectus abdominis muscles. So here is the option, answer is the myofibroblast. Other option here, but they are not answered, because we know the extracolonic manifestation of the FAP mesodermal derivatives is the, what are they? They are the desmoid tumor, osteoma, that means it is derived from the bones, but in the rectus abdominis there is no bones, and also the dental problem. These are the three mesodermal problem, but only desmoid is true. Other option, that means the osteoma, that means the bones here not present, dental, that means teeth also not present here. So our only answer is the desmoid tumor, and it is derived from the myofibroblast. Thank you all.